I'm going to walk you through a strep test. Keep in mind that when you're at the clinical, you may not use a strep test that looks just like this, but they all have simple instructions. These are wave tests. A lot of times the instructions are going to be on the front of the box, and you want to follow them carefully. The reagents, this is for this kit, this is reagent 1. This is reagent 2. I've already labeled my patients just in the essence of time. We also have in here, these are external controls. These you're going to run probably once a day. This is making sure that the test is running properly. With every test, it does have something called an internal control. It's on the cassette itself. But these are considered external controls. So they were supposed to mimic patient, a positive patient, a negative. For this, it's going to be for strep pyogenes. You're always going to have a sheet that you're putting your answers on. You're going to want to make sure that you'll either get the specimen that's been properly labeled for you, or if you're at the bedside collecting it, you will collect it and immediately put your information label on your specimen. You'll bring it into the lab. You want to make sure that you're using it, you have used it in a sterile manner. You'll take it out like that, pull it out, and then put it back in here and bring it back to the lab. Following the directions, it says add 4 drops of reagent A, and you're going to want to do it all together. You can't report, if you're running controls, you can't report out the patient until the controls, until you verify the controls are working, but you can run them all at the same time. It goes faster. So I'm going to put 4 drops of my reagent A in each one. Okay. And what I do is I put it behind so I don't run it again. 4 drops of my B, or reagent 2, excuse me. Okay. I'm done with those 2. I have to use so when I'm running controls, external controls, which again, usually once a day, I'm going to add a drop. Again, this is following the directions. Another drop of, this is the negative control in the properly labeled tube. Then I add my patient. And even though I have controls in there, I still have to treat the kit as if I have patients in there. So I'm going to grab another swab. Have a swab in the positive, a swab in the negative. You mix it, mix it, mix it. You can give it a little squeeze if you want after you've mixed it. Just get all that stuff out. Do that for each one. Gonna wait a minute. We're gonna pretend a minute went by. And now we're gonna add our reagents. I'm just gonna put one in here to save the rest of them. You're gonna follow the directions, pull it out like this. You can see it's whoops, it's going, oops, let me get up there. There you go, going down in here. And you're gonna put one into each one. Let that wait 5 minutes. Then you read it. Pull it out and read it. You have to have a internal control, has to be positive, and you can see it there, it's the top up there. This is negative for the patient. My positive control, you can see I have 2 lines there, letting me know that this kit is working properly. And then the negative, working properly, I just have that internal control showing up positive. Again, the external controls kind of mimic a positive and negative patient. And that's how you do that. You would put your results on your sheet or in the computer.